Good morning. I'm John Sheehan with World News Today podcast. I'm here with Margaret Hayden from Sada and Movimento, an American nonprofit organization working in Angola. Good morning, Margaret. Can you tell me a little more about your organization?
Good morning, John. As a result of underdevelopment within the country and a lack of emphasis on women's rights within Angolan society, the state of women's healthcare has been for too long overlooked. This is causing a multitude of problems for all Angolan citizens, including unnecessary illness and death, and adding extraneous stress on the already overpopulated country. Saudi and Movimento's vision is to make healthcare specific to the unique needs of women available, affordable, and accessible in impoverished and rural communities. With a population of 21,205 reported in 2018 from the World Population Review, we think Kala is a town in which we can make a difference.
I know that Angola has a troubled history with high rates of fertility, infant mortality, pregnancy-related deaths, and HIV. Can you tell us more about that?
Yes, that's correct. So our goal is to provide healthcare targeting at-risk Angolan women in Kala to combat these issues. A lot of the healthcare problems stem from poor infrastructure and water sanitation and access to basic healthcare essentials according to USAID.
That seems like a big issue. Do you think you'll be able to tackle it all at once?
Well, we have three main project goals that we can implement all under the umbrella of a mobile health center. Our objectives include providing water and baby formula to new mothers, family planning education, and prenatal packages to women in Kala.
Tell us a little about the issue with water. I know that consumption of unclean water can have severe consequences for expecting mothers and newborns.
UNICEF has described a recurring issue detailing little access to drinking water in Angola, with water replenishment trucks being scarce, and 6 in 10 families receive water from sources of questionable quality. Some mothers are malnourished, and while breastfeeding is preferable, it is not always feasible. The mobile health centers will distribute clean water, drinking water, primarily targeted for the use with baby formula.
Do you think there will be problems in distribution of the clean water?
There is a concern that the system could be abused with regards to overconsumption of available water. As some towns have gone 2 weeks without receiving any water, we understand the possible risk.
That situation seems truly concerning. How exactly do you plan on remedying this situation?
We will provide all citizens with a daily average of 15 liters of water for cooking, drinking, and baby formula in order to offset the 20 liters they already live on. Along with this, we will provide extra at a minimum cost of $1.50 per 2 liters.
Okay. You also mentioned you wanted to provide comprehensive family planning counsel. According to a community survey done by Bixley Berkeley, 47% of respondents said they were using no family planning method at all, and half of the pregnancies in the last year were unwanted or mistimed. Can you speak more about that?
According to the same report, many women visited health facilities within the last 12 months. However, very few reported receiving any information on family planning. Our mobile health centers will provide education through volunteers trained to properly disseminate the information. By focusing on various topics such as contraceptive use, safe sex practices, and prenatal advice, we believe that education will be the key to breaking the cycle. A part of the services will also include fighting the stigma behind HIV and other STDs.
Do you anticipate setbacks in providing these educational services?
Well, there is a risk of cultural acceptance. We hope that families will welcome our efforts. However, we do not expect total acceptance. In order to combat this, we will create incentive, such as extra formula and water for those who attend educational classes.
Moving on, earlier you mentioned your final goal was to provide prenatal packages to women. Could you please expand on that?
Our last objective is to provide free vaccines and prenatal packages for expecting mothers. Trading Economics estimated that in 2016, 81% of women in Angola were receiving prenatal care. However, most of that is focused in densely populated regions. We want to provide those services to rural regions as well. This will help lower pregnancy-related deaths and infant mortality rates significantly.
Do you guys predict any obstacles that could inhibit this goal?
Yes, we do. Management Sciences for Health tells the story of Sophia, a pregnant woman who suffered extreme pain and complications during childbirth because of an improperly administered birth-inducing drug and the lack of an operating room at her nearest health center. This is not an uncommon narrative. In order to combat this issue, we are utilizing the skills of trained doctors and nurses.
These goals are very noble. I know that from prior research, high infant mortality rates are due to unsanitary water that families use for baby formula. HIV is also extremely prevalent in Angola. According to UNAIDS, there is an average of 310,000 adults and children living with HIV currently, and women are habitually dying from lack of adequate prenatal care. So how exactly do you plan to monitor the success of these programs?
We plan to monitor the success of all of these projects over a course of 5 years through observing the decrease in infant mortality rates, HIV prevalence, and pregnancy-related deaths through reputable reports issued from our partner at the Ministry of Health in Angola.
Continuing with the 5-year timeline, how do you expect to effectively achieve all of your goals?
It's a big task, but that's why we chose mobile health centers. We can get our trucks and most supplies from the vendors in Africa, eliminating transportation costs, and contributing to the local economy. Additionally, we are partnering with Catholic Relief Services, local nonprofits, and the Ministry of Health in order to provide the proper professionals needed to staff our mobile health centers. We believe our goals will be achievable because similar projects have been implemented in places like Mozambique, and they have seen positive results with similar budgets of around $200,000 a year.
Well, that is all the time we have for this interview. Thank you so much for coming in today to enlighten everybody about the great work your organization is doing.
Thanks for having me.